Sverre, now I wanted to take our audience to your research site. The Southeast Asia, particularly Thailand, Laos, and Cambodia border region, and we know the situation there is almost it's starkly different from Australia. Australia is a huge island. It's even
Yes.
the island, and nevertheless, so you said that Australia is very good in closing border, but of course for Thailand and Cambodia, Laos, I mean that is the last thing they will be able to do, close borders.
Yes.
And so how have they dealt with the COVID? And also we notice the COVID up and down quite dramatically in that region. Can you tell us, again, from the lens of territorial and logistical ways of governance?
Yes, look, this is really interesting, and I followed, of course, what's been happening in the Mekong region with great interest. And one of the main things that I've been sort of thinking about, and especially when it comes to Thailand, which is a main receiving country of especially labor migrants from Cambodia, from Laos, and also Myanmar. And it's really interesting in terms of the health sector, because again, if we think about again, territorialized forms of governance and also this securitization logic, and how we can think about that in terms of how it either excludes, divides, or incorporates populations into policy frameworks. What is fascinating in, say, a Thai context is that Thailand has a bit of a history of having, in relative terms, a relatively liberal approach in terms of healthcare and migrants. So, and again, I should make it clear to people who listen to our talk that I've done research on labor migration issues in this region for quite some time. So my angle here has to do with labor migration. So, for example, for quite some time, migrants, many of them over the years also have been able to achieve legal migration status, so that they're able to travel on, say, passports and obtain the work permit and these kinds of things. So they are much more able now than in the past to access health services, but also undocumented migrants. Thailand has up until, and I think they still do this, they actually allow health insurance regardless of legal status, for example. So this is quite interesting how they have, in a way, been relatively speaking flexible when it comes to incorporating and folding in migrant populations, including undocumented migrants, into healthcare. I shouldn't paint a too rosy picture. That's not to say that there's never any problems, and of course there are reports of discriminatory practices in hospitals and these kinds of things. And there are huge problems sometimes with payments, for example, for health services and so forth. But what fascinates me is that one of the reasons they did this in the past has always had to do, at least partially, with the recognition that it's not a good idea to exclude populations when you're dealing with problems around communicable diseases. So there has been cases of, say, issues around tuberculosis with migrant populations, etc. And if you have a problem with communicable diseases, you want people to be able to get care, healthcare, not to exclude them, because then that's going to be a bigger health problem and a real headache in terms of public health. But what seems to have happened now, though, sadly, is that as we speak now, I think perhaps the Thai health system has come under so much strain and pressure that now what we seem to see is more of kind of dividing practices and happening where, for example, COVID tests, and other forms of treatment, vaccine and so forth, where migrants are more excluded perhaps than in contrast to what I alluded to earlier in terms of sort of healthcare. So we seem to sort of have moved from inclusion back to exclusion in some ways. And it's really a problem. I was reading in the news the other day that, and I should emphasize too that, I haven't been able to do direct field work on any of these things or any systematic research. It's more about following what's happening in media. But one report in terms of returning Lao workers back to Laos indicated that around, I think it was 20-25% of them had COVID, which is a very, very high infection rate. And again, I need to treat this with some caution, but there are some media reports that is suggesting that yes, you have very high levels of transmission amongst migrants. So again, I guess COVID, you know, it does visibilize to us a lot of I guess inequalities in societies and all the kinds of systemic problems in terms of distributive mechanisms in our societies. And this is something we've seen a lot in this region. A thing about Thailand, of course, is that it's a country that is so heavily dependent on labor migrants in its economy. You have millions of labor migrants, so you can imagine the impact that COVID has on this. I mean, the issues are numerous, right? So we have, for example, a lot of migrants working in factories, construction sites, and so forth, where you can imagine that living conditions are very cramped. People living in dormitories. Already there, you're going to have huge issues around social distancing measures and so forth. Then you couple that with uneven access to healthcare. You're starting to have compounding issues, right? Another thing that I can sort of speak to a little bit about the impact of COVID is, of course, that it generates several kind of almost polycentric forms of problems. So on the one hand, we have just the mere fact that you have an enormous economic and financial crisis. That's not unique to the region, of course, this has happened globally, but because of the heavy reliance on labor migrants for its economic productivity, that becomes a real problem. So one thing that we've seen in the region over the years has been a lot of attempts to try to formalize and legalize labor migration through bilateral agreements. But now when COVID hit, suddenly you have a situation where these formal pathways for migrants to work in Thailand from Myanmar and Cambodia and Laos have broken down. Because of COVID, they simply couldn't operate anymore, right? So suddenly you have a situation where then you have migrants who are in Thailand already on contracts, right? Legal contracts through formal systems, but they can't go back easily because of border closures, right? Many of them also lose jobs because suddenly the factory can't operate anymore because of COVID-related impacts. So you have a huge sort of stranded population of migrants who, many of them, not all, but some of them at least, are out of work, coupled with this inability to return back. And then you have other migrants who might be, say, in Myanmar, and they may have signed up for contracts. And many of them may have even paid upfront money for these contracts because there are various fees involved with passports, work permit, etc. And sometimes this involves also paying fees to recruitment agencies or even brokers. And then they struggle with recuperate their money because they paid all these fees, but the recruitment agency is not paying it back to them, right? So this is an interesting impact of COVID, is that you have kind of this accentuated debt arrangements, if you like, or bonded, bonded in the sense that migrants have paid money for migration, but the migration isn't happening. So they're kind of sitting idle, just waiting for migration to happen, and the financial resources have been frozen, as it were. And what is interesting is that there's some indication too that this is even happening to recruitment agencies and brokers. So for example, recruitment agencies in Thailand, they have to pay a fairly large bank guarantee in order to have a license to operate. But now, because they can't trade, they in effect have these enormous financial assets frozen through bank guarantees. So there's an issue there too about actual, as part of migration infrastructures, you have these recruitment agencies, but also brokers who then also in a way get stuck, if you like, financially speaking, because of COVID. A final thing to say about all this, I think, is, I guess, just all the difficulties around COVID adds administrative layers to labor migration. So, in addition to passports and visas and work permits, suddenly, COVID testing the possibility of maybe having, maybe if you're going to have labor migration happening, we need to have quarantine systems as part of the package, as it were. And of course, what this has done in practice is that it adds cost to migrants, right? So, and as an extension of that too, it also seems to also generate brokers, so brokering practices. So for example, one thing that's happened in Thailand is that because these formal legal migration pathways have been so difficult to continue during COVID, now they have reintroduced something called pink cards. Now, pink cards is something they used to have in the past. It's a temporary work permit, which was basically kind of a duct tape solution to the fact that you have a lot of undocumented migrants. So they gave all these kind of temporary cards to migrants without necessarily being able to necessarily identify their identity properly through national verification and so forth. So now they have to kind of reintroduce these pink cards. But as part of this, for a lot of migrants, they find it, although it's not a too complicated system, still a lot of migrants who are maybe semi-literate or even illiterate, etc., they have difficulties with this, so that they become dependent on brokers to fill out forms and to apply and so forth. Even just to, you can do this online, you can actually apply for this online, but then many migrants don't know how to do it, so then you have this flourishing of brokers. So this is an interesting sort of impact too that we see now unfolding in a COVID context.
So that's thank you. There's such a rich narrative about the situation there. One point that I learned that is particularly interesting to me is that, of course, we know that, but your story really reinforce the point that migration in many aspects actually is quite similar to finance in the current context, right? Because migrants have to pay. But it's similar to finance not only because the money is involved, but because the time is so important. Everything is predicated on a expectation that the things will circulate smoothly. So I pay in advance, so I earn money and repay the debt. So I mean that can carry on. So therefore, temporal disruption is particularly disruptive, right? Because everything is predicated on the assumption that the circulation will go on smoothly, right? Once there is even small stoppage, it will have quite a ripple magnifying impacts. So, and then here we see two setbacks in the region that you are working on. One setback, as you mentioned, Thailand, it seems used to have this relatively liberal and open healthcare system for migrant workers, even for illegal migrant workers. And now that has kind of been withdrawn, but probably because of the lack of resources. Second setback is about region-wide legalized orderly mobility system. It is also interrupted. On both these setbacks, I mean, it's sad to know, but I wonder whether or not you can comment on in the future, if we want to prevent such setbacks, what more could have been done? For example, if we focus on the first one about the health care for migrant workers, I was thinking actually it is a third method, a third method in addition to territorial, logistical. And this is the third measure is through welfare provisioning. Actually, you can also regulate mobility. It is also kind of sense of securitization, but very different from what we discussed earlier. It's not about tracing and monitoring, but it is by providing safety nets and providing care to make mobility safe. But what do you think it could have prevented this setback? For example, if there's a more coordinated region-wide resource sharing, so the more resources can be timely delivered to particular place where large number of uninsured, particular migrant workers are. So probably we would not suffer from this setback. Oh, do you have any thought about that?
Yes, it's a great question, and it's something I've been sort of thinking about a little bit during these COVID times, and it's really difficult to articulate in a clear way, and I'm still thinking this through a little bit. But I mean, one of the challenges with so here we're talking specifically about labor migration and I guess partly sort of extended welfare questions to a large extent around health, but possibly other things. And one of the difficulties with some of these measures before, I think, has been always the fact that, so you mentioned this temporal dimension, right? So one of the real impediments, I think, for a lot of labor migrants in a broader sense has to do with resourcing in both financial and temporal sense, right? So it's about cost of migration and also, having to wait and these kinds of things, right? Once you get stuck because you have to wait for processes and so forth, this becomes a problem for migrants and indeed for employers too, because often employers then need workers quick. And so there's a resourcing question, and then you also have a question around complexity of systems. So it's kind of a system question. And so prior to COVID, me as a sort of labor migration researcher, if you look at, for example, questions around abuse of migrants and questions around brokers and so forth, those two things, the questions of resources in terms of time and money, as well as questions about complexity. Once you have complexity and resourcing requirements, time and money, you are creating situations for migrants, right? And in my mind, so looping that back to this question of health and welfare provisions, I think that one of the good things about having liberal approaches to things like healthcare and so forth is that it helps, it eases pressure on migrants with those kinds of problems. But how to avoid it in the future? Well, I mean, there needs to be some level of political will to actually to incorporate these migrant populations into policy regimes. And I think that's the litmus test, if you like, of these liberal regimes, is that one thing is to have a liberal regime when your economy is going well and everything is kind of normal, right? But once you have some kind of crisis, such as a pandemic we're having now, that puts things to the real test of the robustness of policy regimes, I think. And I guess what we are seeing in a place like Thailand is that some of these liberal approaches, perhaps, they might be slightly, they don't stick very deep, So to deal with this in the future, it partly becomes a question of political will, and that's a difficult one. I guess one of the things that this is going to sound like a policy talk, but one thing that politicians need to think about in this context will be there's a lot of benefit for say employers and the general society, because the dependency on this labor migration force is so huge that you need to think a bit more holistically around how these migrant populations are how they fit within a broader picture.